Well, we're getting to that time of year where everyone loves to look at what's happening with their health care. Open enrollment may mean paperwork for some if you want to make a switch, but that also may mean some savings, especially if you're a member of Ohio Farm Bureau. Director of Health Services, Trevor Kirkpatrick, joins me. Always great to see you.
Good to see you.
So this is a brand new option, and I would say with a lot of things Farm Bureau does, it takes a long time to get through the process, but to get these Ohio Farm Bureau health plans up and running really didn't take, considering, all that long at all.
Yeah, it's been amazing to look at the process, right? The governor signs a bill in July 1, and now we're offering them to the public for applications open already here in November. So very exciting times at a blazing speed.
I mentioned that a lot of people at this time of year are looking at their options for health care. And so this is a perfect timing for you guys to unveil this. Tell us about health plans and why, whether you're a member of Farm Bureau or not, you ought to look into it.
Yeah, Ohio Farm Bureau health plans are for Ohio Farm Bureau members, but take a second to realize what is a member. Anybody who supports our mission, strengthening communities, growing agriculture. And you could be an Ohio Farm Bureau member. Therefore, you could possibly qualify for Ohio Farm Bureau health plans. So we're very excited to have this option out for the public. Not for everyone. It's for everybody that is 64-year-olds and younger and who have a system of medical underwriting. There is that place where it keeps the affordability intact. So there is a little bit of that goes into play, but it's another option for those who might qualify.
And how exciting for those that work off the farm just because they need health care. If they find something within the Ohio Farm Bureau health plans, they might be able to be at the farm full time.
That's right. That's our hope and goal, right? If we can keep the farmers farming, keep those individuals on the farm instead of the spouse going in town to get their health coverage, let's have them both on the farm to keep growing what you love right there in your four walls. And health coverage not be a problem, right? We want to be able to offer that. You can buy it. These health plans are that, hopefully, for those who do qualify.
What kind of questions do you get? This is not an easy issue.
Right.
There's a lot of, there's red tape and there's different plans depending on what is good for your budget, what's good for your family, the age of your kids, all that goes into consideration. What are some of the things you get asked as you begin to roll out these plans?
Yep. So you started the conversation with, affordability, right? What's it going to cost? That's my number one question. So I get it all the time, but that's a very hard question to answer because it is directly related to where you live in the state of Ohio. County is different. It's age banded. So the highest age person within your family is based off of that. And then it goes into the medical underwriting piece, which I just mentioned. If you were to qualify, then there's a little bit of a tiered system. If you do have a little bit of health concerns here and there, you're going to have a higher premium than those who is not tobacco using, who is very, very healthy. So really hard to say your differences. However, we are seeing in other states, I know it's a little different than Ohio, but we have seen up to 40% savings compared to the ACA, the Affordable Care Act, which is very exciting. Now, it could be 5% savings. It could be right at neck and neck, right? But we're seeing a very hopeful forecast depending on who you are and where you live and what your age is what it'll cost us. How can we get it? As another big question I get. I heard this new thing. How do we do that? So Ohio Farm Bureau healthplans.org is a source of all information. We also have an agent map where we always recommend talking to that individual that knows them, that's trained in them. So we have certified agents all across the state that can go to the Find an Agent map on our website, Ohio Farm Bureau Health Plans.
Yeah, and building those relationships across the state to offer these plans. What has that process been like? As excited as members are, I have to imagine that those that are selling the product are equally so.
Oh, yeah. Yeah, it's been amazing to watch. And huge shout out to Ohio Farm Bureau, right? The name's on my chest, but it's been such a exciting time to get everybody together and put something out there for everybody in Ohio. And so it's been exciting to see that, but also a lot of good, interesting questions that I've had in a position that I started not too long ago. So I'm kind of learning with everybody, but getting them the information that they need. So, and as we look at the 30,000 foot view, what's happening in this country right now, it's really perfect timing. And we're keeping a close eye on that. But to have this additional option for people who hopefully can save on their bottom line and have really high quality health care is very, very exciting for us at Ohio Farm Bureau.
The website again?
Ohio Farm Bureau healthplans.org.
Trevor Kirkpatrick, Director of Health Services with Ohio Farm Bureau, our guest on the Ohio AgNet. Thank you.
Thank you.